Hello everyone, good afternoon. Welcome to Jambo Radio. You're listening to Positive Health Hour. We are live now and we will be on Facebook, on the Jambo Radio website, so you can tune in between either platform to watch the show. To also get onto the Jambo Radio website, it's www.jamboradio.co.uk. We are Waverley Care and we've been here previously, over 2 months, talking about one of the very important subjects that we, know our community needs, and that is talking about positively living with good health, with specific focus on sexual health, which is, sometimes something people don't like to talk about, but it's nonetheless a very useful thing to talk about because we all have, a sexual health to look after, whether or not we think we do. So far you're sexually active, so far you're having sex, you need to look out for your sexual health. My name is S.A. Johnson. I am a staff in Waverley Care and I work on the Minority Ethnic Communities Project. So making sure the voices of people like myself, if you can't tell from my accent, I'm a Niger boy. So making sure that people like us are represented in these conversations, but also our needs are included. On the show as well, we have a special guest today. By name of Papa. Papa will be introducing himself in detail a bit further, but just give us your name, Papa. Your full name.
Papa Yao Osafo.
Good. So today we're going to be talking about something very, mind-blowing and something, very new. Well, maybe not very new in terms of years, been around for a few years, but also creating a lot of waves. And this is what we call PrEP. It's a medicine that is called PrEP. It's spelled PrEP. I can tell some of you might already be checking your phones for what it is, but do not worry, we're going to be breaking down everything PrEP today. We would have a call-in section as well, so as the conversation is going, if you have any questions you want to ask, if you want to drop any comments on what we're talking about, you can phone in live onto Jambo Radio at 0743 7826 865. I'll repeat that again. To phone in live, you can dial us on 074 378 26865, or you can also drop a message on WhatsApp on 078 583 40661. WhatsApp number again is 078 583 40661. And just to remind you, we're going to be talking about PrEP today on the Positive Health Hour. So time to get to know a little bit about our guest. So we're just going to play a quick video in which our guest was the main center of attention, the actor extraordinaire, and have a little bit of a chat once we go through that video and hear the conversation.
Such a good night.
Let's
Finally
wait on the video to come up now and we'll be able to watch it.
Nice to meet some
great.
of Maya's
Good to go.
friends too. Things with us have been going good.
Okay, thank you very much for watching that quick video. And I'm like I said, Papa is the the main act. So just to get to know our guest a little bit more, Papa, can you tell us a little bit more about yourself, who you are, what you do, how you've stumbled into this office?
Okay, guys. I'm Papa Yao Osafo, but I'm normally known by Papa. I'm a graphic designer by trade, but normally I'm an entrepreneur. I own a digital marketing company and also own an events company as well. And we will actually be running an event for in favor of Waverley Care. Also, how I got into this? Yeah, I got into this. I do extra work on the side, and I also do acting as well on the side. Something I've been doing it for a couple of years now. So I actually got into. I was contacted by my agent. They were looking for black people to act in the role. They were trying to do a campaign to support, to kind of talk about PrEP and the kind of the impact it poses in the community. To be honest, I'm someone that I like to play like a permanent role in the community, in the African community especially. I try to do the best I can and everywhere I can to support the community, because I know how it is when you first came here as well. So I like to kind of like I'm someone that I'm not. I won't like to say I'm on the top. I'm on my way to the top, but I know that for me to get there, I need to go with others. As the famous saying goes, if you want to go far, go with others.
Exactly.
So I got into it, and when my agent spoke to me about it, and as soon as I found out it was something to support the community, I said, yeah, great, like let's do it. I didn't even know what it was. I didn't know what PrEP was. So before I came to the shoot, I had to do some research, of course. I did some research and I found out what PrEP was and how it helps people. And then we did the shoot, and then of course after the shoot, SA approached me and said if I would like to come on and speak about PrEP as someone who was naive to it and now knows a bit more about it, and also a chance for me to also learn a bit more as well.
Thank you very much. And I like the way you phrased that, saying, moving from a place of not knowing anything about PrEP, but taking the time to, research it, because you were going on the professional stage to act this campaign out. For anyone that might have missed the short video just now, it was basically an NHS funded short campaign to tell the public what PrEP is and the values of PrEP and the advantages. So being part of that campaign, can you break down what it was? What did that campaign, what was it really focusing on, and what was it bringing to the table?
It was focusing on PrEP, and actually, like, from the campaign, from what I understood from it, was focusing on PrEP and the kind of advantages and how it can help you, and like it's kind of battling the stigma behind certain things associated with PrEP, certain things associated with the HIV and hepatitis C, and the whole campaign was to show like you can still live a comfortable life even in spite of having those diseases and those viruses. So it was actually the whole purpose of the conversation, of the ad was literally to kind of boost it out to the community at large as well, because we know that yourself in our community, like, is rampant, and something like this would do a lot more help. Our community, there's a stigma behind having HIV, and everyone thinks a death sentence when you get it, but most people don't know that you can live your life comfortably. I mean, for me myself, like, I knew that there's things that you can take, but before the ad, I knew there's things you can take that can make you live your life comfortably. But I didn't know it was PrEP. And so when everything kind of, like, doing the ad made me connect all the dots together, I'm like, oh, okay. And I became more educated about it, made me realize that, okay, like, even me, like, I had some preconceived notions about the virus as well. But once I did the ad, I got to study about it, got to speak to the people that were doing the ad as well, and I actually got to find out that it's not as bad as people think it is. It's not like a scary bug that it only kills you because of ignorance. It only takes the ignorant, never takes the people who are knowledgeable. And as we all know, knowledge is power.
Absolutely. And for you might be asking already, what is this PrEP that we've been saying? What is PrEP that we've been saying? So PrEP stands for pre-exposure prophylaxis. And basically, it's in the name. Prophylaxis, something you take to, prevent something. And pre is before you are exposed to that thing which you're taking the drug for. So PrEP in itself is a drug taken before someone is, exposed to HIV. So, in whatever way the person might get exposed to HIV, earlier in the show, we've talked about, in previous months, we've talked about how HIV can be transmitted, through unprotected sex, so that's sex without condoms with someone who has the virus and is not managing it with their medicines, or, through blood transfusion, through mother to child, from, childbirth or breastfeeding, all of those different ways, So what we're saying is PrEP stops, someone from getting HIV, or prevents them from getting HIV if they are exposed to it through sex. So you've mentioned slightly about, you had some opinion, or you didn't know much about PrEP before, and taking part in this, campaign kind of shed, some light on what PrEP is. I'll ask you this question. So, for example, if I had walked up to you prior to being on, part of that video, and I had said to you, on the street, oh, hey, brother, do you think you want PrEP? This is what it does with HIV. What would have been your reaction in that moment before you knew much about it?
I'll be very honest. My first thought would be like, I'm alright, I don't need it. I'm good, I don't need it, I'm good. I'm alright. Like, I'm not, like, you always think, like, oh, I'm not getting with people like that, so I'll be fine. Like, it's that kind of, like you always think, I think it's that kind of, you feel untouchable, because you feel like it won't be me. It might be the next person, but it won't be me. And that's that kind of mentality that we all have until it is you. And
Yeah.
and I think if it came to me that would be my first reaction. I'd be like, nah, save it for someone else who needs it, not me. Yeah.
And that's very interesting, isn't it? It's like you said, your first expression would be, oh, this is not for me.
Yeah.
Save it for someone else who needs it. And you know, that's sometimes one of the things that people think when we talk about PrEP. They say, oh, it's not for me, you know, for whatever reason, you know. They can say maybe it's not for me because I don't look like someone who is exposed to HIV, or I don't look like someone who should be thinking about HIV. It's like, no, if you're sexually active, if you're having sex with, you know, anyone and you do not know their HIV status, you do not know whether they are positive or negative, and you know, sometimes if someone is even HIV positive, they need to go on their medication first of all before they can get the virus managed. So basically anyone, you know, who is having sex could be at risk of HIV, and that is the important thing, you know, saying stop and think rather than jump into the, oh, that's not for me, this doesn't affect me. So that's it. That's a very good lesson to have picked from that. Now, looking at after you've been part of, you know, this NHS funded campaign, what is your, you know, what have you learned from the process? What are you taking away? You know, not just about PrEP in itself, because you've learned about that, but what are you taking away from the process of being involved, especially being involved as someone of African heritage?
Yeah. I found out like the virus doesn't discriminate. It does not discriminate. Whoever you are as white, Chinese, black, no matter who you are, like you are as easily exposed to it as anyone else. You know, no one is untouchable. And you can either be a fool or be knowledgeable and prevent it from happening to you. And that's what I took from it, because like even before coming here, I was doing a lot of research as well, and I found out that like the HIV virus in England is literally on a sky rise in England. Like it's on it's higher than it's ever been than ever before. And it's crazy to think that if all these people knew about PrEP, they could have saved themselves of any. And to think, but it's something that is not really being spoken about as much as how big it is. You know, no one is actually talking about it. Like it's really, really rising in England. I don't know about Scotland, but in England it's really, really rising. And to think that PrEP could have saved a lot of people from having to live with it.
And when you mean rising, so it's like the numbers of people being diagnosed now with HIV. You know, there's a higher number with people from Black African backgrounds, which shouldn't be, because in the end, you know, there's other pockets of society who are learning the advantage of PrEP and are using it. You know, and it's you know, even in Scotland, when we're checking people who are newly diagnosed with HIV, there seems to be a bigger increase, should I say, or a lot more of increase within Black African populations, and it comes to even sometimes people who test, but they are testing at a very late stage, which shouldn't be, because, like you said, PrEP's available. So we've talked a little bit more about our guest and, you know, how he's got involved with PrEP campaign work and things like that. We'll go on a quick music break now, but stay tuned to your radio, stay tuned to your to where you're watching us, and we shall be back to even dive deep into this PrEP itself and what exactly it is and what it does and where you can get it, things like that. So listen now and see you in a bit. Welcome back. We are back again, Positive Health Hour, talking about PrEP. I'm here with Papa, our very able, you know, very strong, very, very vibrant actor, you know, taking on leading roles, talking about the importance of you know, HIV and sexual health, talking about these things within Black African communities. Remember again, you know, if you want to drop in a question on WhatsApp, just dial us on, or rather drop your question on 078-5834-0661, 078-5834-0661, or you can phone in live on 074-3782-6865, 074-3782-6865. So just being back now, Papa, what exactly is it that you would like to know in specifics about PrEP? You know, if you were someone who'd never stumbled across it.
Oh, I would say, what exactly is PrEP? Like, what is it, and where can I find it? Especially we're in Scotland, so where can I find it in Scotland?
Yeah, so like I said before we went on break, PrEP stands for pre-exposure prophylaxis. You don't need to know all of that stuff in your head. The
That's
words.
a big word.
Yeah, it's a big word. But it's PrEP. Basically, prepare, PrEP. It's a medicine that people take, before, they get exposed to HIV. So it's like, it's not maybe not before oh, maybe I'll be exposed tomorrow, I'll take it. No. PrEP basically is like anyone who thinks they might be at risk of HIV, take PrEP, and that prevents them from getting the virus. So what do I mean by at risk of HIV? Like I said before, if anyone is having sex and between, as far as they can remember and today that we're talking about it, if they've never, found out about their partner's HIV status, they don't know if their partner is negative or positive, basically, they could be at risk of HIV because you do not know where the other person, whether they have the virus or not. Yeah, HIV is manageable with medication. HIV, anyone who is living with the virus, taking their medication, they can pass the virus on to someone else once they achieve, that suppressed level of the virus. But also they have a full life expectancy. But what we're saying is there's a way to prevent, getting HIV in the first place, which is this medication. For men or people who have sort of male organs, they can take PrEP every day, or they can take it sort of a few days before they think I might be exposed. So for example, if someone is going on a date, and they think it's going to go that way, they are going on a date, they think it's going to go that way.
Get lucky.
Exactly. It's like Monday, you've texted this person, you say, let's meet on Friday, let's go into town, let's have a meal at Calabash. You don't know what's going to happen from there, but if they are thinking, maybe not, they can take PrEP, just, within a few days before then. Usually it's, always described once, you get to the clinic, which I'll be talking about. And then they take it for a few days after, they've had the sexual encounter or they've had sex, because then that prevents, it sort of completes the loop of preventing them from getting HIV.
Okay.
For women, they can only take PrEP every day, the way they take the contraceptive pill. So that's the slight difference between men taking PrEP and women taking PrEP, is that for men, they can take it either every day or they can take it as what we call events-based. So around the events, the time when they think they might be exposed to HIV. To get PrEP in Scotland, all you need to do is book an appointment with your sexual health clinic, and that's the nearest sexual health clinic with you for so book an appointment for PrEP, and you get called into the sexual health clinic. You have a conversation with in the clinic with whoever is attending to you, and then they sort of put everything in place to describe, do you actually are you someone who actually would benefit from PrEP, or looking at different ways to help you, and then someone can then go on to PrEP in this way. Some people choose to buy PrEP online. They choose to get their PrEP online. There's a website called I Want PrEP. iwantprep.com. So it's a website where people can get their PrEP as well, but they'll still need to do regular checkup, just through their sexual health service. And just to say, PrEP is free in Scotland. So if you're a resident in Scotland, you're living in Scotland, PrEP is absolutely free for you. You don't have to worry about paying it or paying for it on the NHS. You don't have to worry about, paying for any of the tests associated. All of the services in the sexual health, all of the things you can get from the sexual health services in Scotland are free to anyone, regardless of, who they are. But living in Scotland, you get free PrEP. So, looking at PrEP now, bringing it back home to within our community, within our community as Africans, you did this campaign, and we still keep coming back to the campaign. For anyone who's not seen it, go to prep.scot, prep.scot, prep.scot. You'll be able to find the video to be able to watch this campaign. So from this campaign you did, Papa, what do you think about the usefulness or need for PrEP within our community as Africans?
Yeah. So something if it's affecting you more, then you need to do something more about it. We can't just kind of turn a blind eye to it, or play ignorant to it and go, it's a stigma, it's a stereotype. The truth is, fact is facts, and numbers are numbers. It is more on our side, and we need to do something about it. So it's not, sometimes we just have to open our eyes and look at figures and just realize this is causing us. It might be me, it might be my brother, it might be my sister. We need to spread the word, get the knowledge out there and help people, and that fear of because now you just said yourself, can get it online. There's no stigma of some people. Sometimes our people, you know how it is for our people. Sometimes they're scared that someone might know, and the stigma, and in our community we care a lot about our reputation and about being embarrassed, or so because of our embarrassing the family or things of that nature. I think for us, that's like the things that's making it more rampant in us, because we don't take precautions to stop it, because we are scared of how it's going to make us look. So we're too worried about how it make us look instead of stopping it from actually harming us. So I think like campaigns like this are very, very good and very, very important for our community, because we need to do something to stop this, and we can't sit there and wait for anyone else to stop it. We need to make action. We need to take action ourselves and actually do things to stop it. That's one of the reasons why I wanted to campaign, because I wanted to do my part to support like this.
Yeah, and I like what you said in terms of like, in the end, no one can do anything for us better than we can do it for ourselves. Whether as an individual, if you want something, no one else can do it or get that thing for you as good as you would do it for yourself. But as a community also, if we're saying that according to the data that we're seeing, the data that's collected across Scotland, we're seeing that there's higher percentage of new HIV transmission within our community as Africans. It is our responsibility. Yes, we're supported by the government, and we're supported by the services, the clinics, and everything. But it's our responsibility to also say, as an individual, I'll look after myself. Yeah. If I think I need PrEP, I'll go for it. But also as a community, we should talk about the advantages of PrEP. We should talk about the fact that whether or not we are used to talking about sex or not, it's happening, and we need to look out for ourselves. It's changing that perception of this is not who we are. No, it's who we are. We need to evolve. To say, yes, maybe a few years ago, we don't talk about sex, we don't talk about sexual health, we don't talk about relationships. That's private. You can talk about it in your own, with your beliefs in your own private way, but also still understanding the sharing of information is the most important bit. I tell this person tells that person, keeping everyone informed of exactly, where we are and what we need to do to look out for ourselves as a community. Yeah. And
even that, like, it's not, sometimes even if you don't want to share yourself information, you don't want to keep yourself, don't be selfish. Like, take care of yourself as well. Like look after yourself. It doesn't have to be something that you're sharing. Like, we're not saying everyone should be an ambassador, but look after yourself. Look after yourself, because at the end of the day, you don't want to have to live with yourself. Make sure you're okay. Make sure you're breathing well. Make sure you're okay. The same way you make sure like you're living well. You're living well, taking care of yourself. The same way, like, you should also make sure that everything that about yourself is well and is fit and is fighting fit and ready to take on the world.
Exactly. That's a really good point. We don't need everyone to be advocates. We just need everyone to look after themselves.
Yes.
Yeah, absolutely. Just working in the HIV and sexual health sector, I know people come up with different things, different questions, or people rather face different challenges in terms of how they can access PrEP, but also people have different needs why they get on PrEP. So, like, if it was you, what would you, how would you phrase such a question to me in terms of like where people are in terms of what they want out of PrEP?
Well, I think the thing that I would want to know is, like, what are the challenges? Like, what are the challenges that people face in terms of getting access to PrEP? Because we know, like, there's a clear distinction that our people are not dealing with this thing. So what are the challenges that they're facing, and how can we mitigate these things?
Yeah, I think so. Like I said, people get on PrEP for different reasons. Okay. Someone is out of a relationship and they want to start dating again. They've been like, oh, I've gone through my recovery, I've gone through my process, I want to put myself out there again. But we also know it's like the first person you date is not the person you will be with forever. That can happen. But also sometimes you might have to, go on a few dates, just see the scene, explore the scene. And then, it's a good reason to get on PrEP that way, because it's like, you never know, like we said it, you never know. It's like, you can go for a date and the vibes are there, everything is going that way. You end from Calabash, you end up in a bar, you have a few drinks. Before you know it, you end up in one other person's house. Before you know it, you're waking up the next morning. Did you take your PrEP?
Yeah.
So it's like, rather be prepared.
What's that saying? Prevention is better than a cure.
Exactly. Prevention is better than cure. Be prepared rather than wishing or hoping, I wish I had gotten, I wish I had done something, or I wish I'd put myself in a position. And if the vibe is going, also sometimes you don't want to have to delay gratification. Let's put it that way. If you are prepared,
delay enjoyment.
Exactly. So that's one of the reasons why people get PrEP. Sometimes, someone is we're living in Scotland, but some of us, home is not Scotland for us. Home is, for me, home is Nigeria. If I'm going home for the summer, it can cross my mind that some people might want some of this meat, because I've been away for a while, so it's not
your prime real estate.
Exactly. So it's like if we're going home, you never know what you're going to meet on the way. So some people, it's like they choose to take PrEP. They're saying, I'm going home, don't know what's going to happen, but I'll keep myself prepared. Because obviously you can't predict. If we can predict everything, we will be in absolute control of everything. So that's like, there's different reasons why people get on PrEP, but also what that means is sometimes there's different challenges for people, trying to get PrEP. So for example, people have different immigration status in the UK. Some people are settled here, some people are, yes, they might be of African descent or heritage, but by all things considering, they're Scots, born and bred here, there's people who have migrated over here either to study, to work, through the asylum process, different immigration status. But that's not a barrier to stopping anyone who wants to get PrEP, because like I said, it's for everyone resident in Scotland, not, documented or whatever, resident in Scotland. So far you live here. Exactly. The sexual health clinics have no right to dive into your immigration status. Their job there is, you say you have a need relating to your sexual health, they provide that need relating to your sexual health, and that is it. Anything that goes beyond that, shouldn't happen. So basically, residents in Scotland, living in Scotland, you are entitled to PrEP, you are entitled to HIV testing. If you are living with HIV, you are entitled to using the service to get your medication to keep your virus managed, so that you can live your normal life and you don't pass it on to anyone else. So that's just one of the challenges that sometimes people face, but at the same time, it's not a challenge if you know the right answers and you can actually get onto PrEP and get some of these services. So as yourself, there's other challenges that probably are going through your head. What do you think we should do, either as individuals or generally just as society, to make sure that anyone who could benefit from PrEP gets it? What do you think we should be doing?
I think knowing our culture and knowing our people, we can sit here and we can speak as much as we can, but we know some, Rome was not built in a day. These things don't happen just as quickly as that. I think for our people, what we need more so is information. We need to get information out there to people, and as well as that, we need to create a sense of privacy for people. So if I'm going to get PrEP, I know that no matter what, it's not going to come out, because not everyone, like we said, not everyone's been advocate, but we want people to take it regardless of what they feel. So because sometimes if we make decisions out of feeling, sometimes it's not always the best decision. So if you have fear, if you have anxiety, if you don't know what to do, it's better to be prepared than face the consequences later on and then regret it. So it's better. I probably say more kind of let people know, listen, you can get it. It's between me and the doctor. No one's gonna know. You can even get it online. Just whatever you do, just get on it and stay safe. And I think it's more like we need to we undermine how important it is. And from my research, I realized this is a dire, I didn't know how big it was. It's a dire case, and people really need to get on it. Because it could be you, just because you think, it won't be me. And how people we are like that. I think as human beings, we always feel that it will not be it will be the next person until it is you.
Yeah.
Why not be safe?
Exactly. And I think you've mentioned two very important things there. The first one being, we're not challenging anyone's beliefs, around, because people have belief systems for a reason. It's what gets us up in the morning, and it's what helps us to look towards the future, look towards eternity. We all have our beliefs. What we're saying is there's information about things that are beneficial to individuals, but also to our community as a general. And if there's a problem that we're seeing, isn't it better to take this information about how to prevent this problem from progressing further and then address it there and then? That's exactly where things are. So I like how you framed it, but also it's things take time.
Yes.
And that's one of the things that we try to make sure we do, in Waverley Care, in the work we do with, African communities or with people from other black or, Asian or minority ethnic backgrounds, is to take the time, first of all, to understand where people are coming from, and then see how we can go on a journey together going forward. The other thing you mentioned is it's best to look out for yourself than regret later.
Yeah.
So for anyone who's not followed this show, the last 2 seasons, or rather two episodes. So I myself am living with HIV, and I was diagnosed in 2019. Got on my medication, achieved my undetectable viral load because I took my medication consistently, still taking my medication. But what that medicine does, like I said, is it reduces the virus so much so that you can't transfer the virus to someone else, or you live a normal life expectancy. So that's all sorted. But there's a part of me sometimes that wishes I wish I didn't have PrEP. Yeah, it's like I wish I knew about PrEP then, when I was, before I got diagnosed. I wish I knew about PrEP, because if I did, then, I would most likely not be living with HIV today. And it's not, that's what we're saying. It's like, yes, there's all of these amazing things to help, manage HIV. And there's a lot of support, even not just around the clinical, manage your health. If someone is struggling with, because HIV sometimes can knock people's mental health, the places where you used to go with your head held up high, sometimes, you might go there a little bit more, less confident, and it's like, we need to, sometimes some of us need to build back that confidence, or challenge other people that say negative things about HIV to say, no, this is not what it is. But the point is, before we even get to those stages, we can absolutely prevent getting HIV in the first place. I can see we have some questions coming in. So Papa, do you want to help us with some of the questions that people have around, because these are common questions we pick up in the community whenever we're out.
Let's have a look. Is there any prevention before someone has been exposed to HIV?
Oh yeah, so we've been talking about PrEP all along. PrEP, like we said, prevents someone from getting HIV if they are exposed to it.
Okay.
But that's not the only prevention that is available. There's also another drug called PrEP, and PrEP is post-exposure prophylaxis.
Okay.
So if you remember what I said about PrEP, PrEP is basically
preparing you for
while this one is post. PrEP is pre, this is post. So if someone thinks I might have been exposed to HIV, for different reasons, they might have, had sex with someone, the person might have texted them the next day to say, I've just gone to get a HIV test and I found out I'm positive, or they think, I didn't ask that person about their HIV status, but maybe someone has said, whichever way, that's not the point, because in the end, with HIV, we are trying to stop the blame game. There is no blame game to be achieved. But if someone thinks, I might have been exposed to HIV, go to your sexual health clinic immediately. If it's during the weekday, call your sexual health clinic, say I've been exposed to HIV. They give you PrEP, and then PrEP stops the virus from taking hold in their body. But they need to start that medicine within the first, it's recommended between the first 24 hours.
Okay.
But if for some reason you can't, then we say between the first 48, 72 hours, you need to make sure you get on PrEP. But also, if for people who maybe work in clinics or work in drug and alcohol services where they interact with people through, syringes, if they maybe take bloods or give people injections, things like that. If they are ever in a situation where they prick themselves with the syringe containing that blood, or just the syringe, with someone who is living with HIV but is not, they are not, if virus is not managed, they also are entitled to PrEP. If you can't get to your sexual health clinic, for example, if it's a Friday, you find out on a Saturday you've been exposed to HIV, go to your the nearest emergency division of the hospital. So go to the hospital, the emergency section, and they will give you PrEP there, because in the end, it is an emergency situation. You're trying to prevent the virus from setting in your body. So those are the two places that most people can get PrEP through the sexual health clinic or the emergency department of hospitals. Some GPs provide PrEP or PrEP, especially if you go up north, you're in the Highlands, in Inverness up north. PrEP comes through GPs most times in those areas. So basically, and if you're not sure where to, Waverley Care is there for that reason. Go onto our website, call us, find out exactly how you can get this.
Another question I see here is, can I take PrEP with medicine, like for instance, like hormone medicine, like birth control and these things?
Oh, absolutely, yeah. So for anyone who is taking birth controls, contraceptives, they can also take PrEP.
Okay.
It doesn't stop them from taking PrEP. But also, we always say to anyone, do not take your medical guidance from someone else, Take it from your trained medical provider. So if you're not registered with your GP and you're listening to this show, please do not let me come and find you. Go and register with your GP, because I know sometimes, even that myself as a Nigerian, it's like back home. Sometimes we don't go to the hospital until it's a dire situation. But no,
I'm the same.
So see, if you're not registered, you're in a place where you can get your medical sort of care free. So what's stopping you? So if you're not registered with a GP, go and register with your GP. It doesn't take long. Go to the nearest GP to you. Tell them you want to be a new patient. They ask you for some details, your dates, your date of birth, your age, things like that, and you're registered and you have access to speak to the GP whenever you have situations, primary care, things like that. So what I always say is, yes, the internet, all of these things are good, If you're not getting information from a trusted medical provider, so from like maybe the NHS website, go to your GP and say, I'm taking this medicine already. I'm taking high blood pressure medicine. I'm taking medicine for, even if you're taking antihistamines for hay fever, and you're not sure if you're starting any other new medication, if you're not sure if they would interact negatively, that's what your GP is there for, or your local pharmacy. Go there and be like, this is the medicine I'm taking, but this is also another medicine I want to start. Can I actually take this new medicine? And then when you go to the sexual health clinic for your PrEP anyways, they will ask you for what medicines you're taking at the moment, so they can decide, is this going to interact negatively? But also, if it interacts, that's not the end of the line. It's about looking for, how do we adjust what you're taking or what you need to take to make sure they don't interact negatively with one another. But yeah, birth control, hormone contraception to prevent unplanned pregnancy, you can take PrEP with them.
What about pregnant women?
Yeah, as a pregnant woman as well, if you are pregnant or breastfeeding. Yeah, if you're pregnant or breastfeeding, you can also take PrEP.
Okay.
Because in the end, it doesn't that's the thing. It's like, it doesn't affect the pregnancy or the breastfeeding. But just again, still the same with the earlier point. If you're a pregnant woman or if you're breastfeeding, you're most times already attached to, a midwife or a local nurse. Speak to them. Be like, this is the medication. Because normally, even I remember when my sister was pregnant, for her first baby, first time around, she's never done it. I was living with her at this point, and every time she needed to take a new medicine, even for some of us who do not know, malaria is still a thing in Nigeria. So even when she wanted to take anti-malaria, she had malaria, she wanted to take anti-malaria, just to make sure, she asked the pharmacist, is this going to affect, my baby? Is this going to... So that's the thing, it's like, always ask. But pregnant women, mothers breastfeeding, you're allowed to take PrEP.
Now, PrEP, PrEP prevents HIV. Does it prevent STIs as well?
No. So it's a big no, because PrEP is only... It's like, for example, if you take a drug to prevent high blood pressure, if it doesn't work for any other condition, it doesn't work, because that's not what it was designed for. So in the end, PrEP and PrEP only prevent HIV. For other sexually transmitted infections, because HIV is not the only sexually transmitted infection. There's chlamydia, there's gonorrhea, there's syphilis, there's hepatitis. So you need to make sure that you are preventing these other sexually transmitted infections if you are not sure, about the other person's sexual health history, So still wear your condom. There's male condoms, there's internal condoms that women can use. Wear your condoms, because that's the only thing that can prevent these other, sexually transmitted infections. PrEP and PrEP do not work for those. Even for unplanned pregnancy, PrEP does not work for that.
Okay.
PrEP and PrEP only work to prevent HIV.
Okay. Now, there's another question here. Is it advisable to talk about PrEP with my other healthcare providers?
Yeah, absolutely. We always say to people, do not be worried about more than one of your clinical providers knowing about your health conditions, because sometimes people get different health services from different parts, especially if someone has a mixture of different health conditions. Sometimes they might be going to the main hospital for respiratory function, things associated with respiratory function. Their GP manages their day-to-day, things like I don't know, their flu vaccine for when it's flu season, but maybe they're also someone who goes to the sexual health services to get tested for other STIs. Yes, sometimes these different areas of your healthcare, they communicate with each other, especially if you've said, yeah, free, speak to my GP, speak to my secretary. But if you're not sure, speak to whatever healthcare provider that you are going to. Like I said, for example, if maybe you're pregnant and you are accessing your antenatal care, but you want to start on PrEP, for example, you can ask your antenatal care providers, tell them, I want to go on PrEP. If they don't know the answer, they would refer you to who knows the answer to ask. It's better to ask and be told where to go than to not ask because we're afraid. Because in the end, like I said, everyone who works in this healthcare sector, they are there to work for us, basically, to work for us and to work with us to make sure that we live our best healthy lives as much as possible. So yes, you can speak to any healthcare provider. What I would also say at this point is when we're talking about HIV, because some people can be afraid to bring up this because there's sometimes very delicate issues, HIV, sex, sexual health. There are sometimes very delicate issues. If for whatever kind of sex you're having, whoever you're having with, whether you're having with one person or multiple people, if you ever speak to a health provider and they shame you or they stigmatize you because of whether you're having sex or about who you're having sex with or how many people you're having sex with or what kind of sex you're having, if they ever shame you or stigmatize you or make you feel negatively about, bringing up that conversation with them, challenge them to their faces. But also, if you can't do it, come to Waverley Care, because that's one of the things we do. We would not let anyone treat anyone badly when you are accessing something that is your right. Whatever opinion they have, they can keep it to themselves. So far, they are in that position to offer you care as a health provider. They are not allowed to shame you. They are not allowed to stigmatize you. They are not allowed to be racist to you or segregatory to you. So if any of those things happen whilst you're trying to access, or get some of this healthcare, come to Waverley Care and we'll take it from there. Because in the end, we're all here together, like I said, to make sure everyone lives their best healthy possible lives.
Okay. Does that happen often?
Yeah, the last episode we talked about HIV stigma, and unfortunately some people still face stigma around HIV and sex, sometimes from maybe a healthcare provider who doesn't interact with, who doesn't work in, the sexual health area. So maybe sometimes they're not up to date on the knowledge and they can still react, they can still be judgmental or stigmatizing. It unfortunately still happens. And we're doing a lot of work to educate people. It's like you don't need to work in the HIV clinic or work in a sexual health clinic. You're a medical provider. Update your knowledge. Get to know what the new information is. Get to know about the medicine that prevents. Not even because you don't want to stigmatize people, but also because you want to be able to provide the right information. Because, and I think that's where sometimes we fall short. We are thinking, I don't want to be a bad person. And we're forgetting that you can also, it's like, I don't want to do that because I don't want to be a bad person. But we're not thinking, I want to do that because I want to be a good person. Okay. Or I want to be a good healthcare provider. Or I want to be a good information provider. We're thinking about it in the negative. It's the same, we're still thinking of the same thing, but we're thinking about different outlooks. Because when you're focusing on the negative, you're only thinking of the bad side. You're not thinking of the good side. So it's like, I want to update my knowledge because I want to provide good information. And then if you're thinking about it in that light, you're going to be able to it will motivate you to, know the right thing, speak to people, get the information out. And not just even for ourselves as well as individuals. If I have a friend who I know maybe is seeing someone new and they've not talked about, have you tested for HIV recently? Do you know what your status is? As a good friend, it's my responsibility to be like, yo, bro, have you heard about this? Because I know, I think you might benefit from it. So do you want to consider it? Or just if just bring it up. Let's try and normalize the conversation. You do it once, it's difficult, but the next time you're doing it, it's going to be less difficult. It's going to be less awkward.
Yeah Definitely. I think when you say that, I think my group of friends, something that we've spoken about as well. Like, we kind of deal with these things, and it's good to talk about this and normalize it, like, to a point where they can make jokes about it. Like, I think that's the best position when it gets, when you are making jokes about it, making fun of it, because then like, it's something you take seriously, but you're lightening the mood. And how we get as guys sometimes, we just lighten the mood with things, and that's the best way to deal with certain things. Then it becomes normalized. At that point.
Absolutely. We've come to the rounding off point of our show. 1 hour is never usually enough to talk about these things. But we'll be here. We'll be back again next month, second Thursday. So we're here every second Thursday of every month, rather. I always keep mixing that up. Second Thursday of every month, between 2 and 3, Positive Health Hour is on, and we're going to be dissecting another angle of talking about HIV and sexual health within our community, but also looking at how we can boost our health and well-being, and make sure that we live as happily as we want to. If you want to get to know more about the things we've talked about today, or just generally have other questions or something on your mind, go to Waverley Care's website. It's waverleycare.com. So Waverley, WAVERLEY, and care, CARE.com. And you can either get in touch by phone, by email, or just filling out the contact us page. You can also find our live chat function, where you can speak with us, speak with a member of staff directly, and they'll be able to either answer your question or direct you to the right person. Follow us on social media, get to know what's happening within the community. We do a lot of HIV testing in the community. We do a lot of awareness talks. We do a lot of, sometimes even community events, to just get people interacting, to get people engaged, to get people enjoying the community that they have available on their doorstep. So you can find out what we're doing on our social media pages. Over the next few months, I'm going to be working on building the confidence of people who are interested in getting the word about things like this out there within the community. So we're going to be doing a lot of, some very interesting, but also some very useful, having some very useful sessions to build up our confidence, things that help us to have conversations, to help one another. So just look out for all of that information as well. And Papa, you have an amazing event at the end of July, so that you want to invite people to.
So it's in the beginning of July. It's the 1st of July. It's comedy. It's a comedy show on Polo, just to raise funds for Waverley Care, just for charity. Just it's our way of doing our part. Like at Red Bell, which is the event company that I co-own with my partner. So it's a great way to kind of trying to raise awareness as well for Waverley Care, and get people more talking about it in the community. And also I think Polo will be a great location, because it is the weekend before Glasgow's Pride Week. So
thank you very much. We will leave you now with Reach Till I Die. You can take this song and reflect on everything we've talked about, and see you all second Thursday in July.
No matter